If you are over 60 years old, there is one daily habit you might be doing right now, without thinking twice, that doctors across the United States are quietly warning about. It feels harmless. It feels normal. Some people even believe it's healthy. But according to neurologists and cardiologists, this one habit is silently increasing stroke risk every single day. Here's the scary part. Most stroke victims didn't feel sick the day before it happened. No warning pain, no dramatic symptoms, just one ordinary day, followed by a life-changing emergency. In emergency rooms across America, doctors often ask the same question after a stroke. How long have you been doing this habit? And the answer is almost always, every day. If you're thinking, this won't apply to me, that's exactly why this video matters. Because strokes after 60 are rarely caused by one big mistake. They are caused by small daily habits that slowly damage blood vessels, thicken blood, and starve the brain of oxygen. According to U.S. health data, nearly 80% of strokes are preventable. Yet millions of seniors unknowingly follow routines that do the opposite, pushing their bodies closer to danger. Doctors say the problem isn't just what you eat. It's not just lack of exercise. It's not even genetics alone. It's a daily habit that affects blood pressure, blood thickness, oxygen flow to the brain, inflammation inside arteries, and once you cross 60, your body no longer recovers the way it used to. Blood vessels become stiffer, the brain becomes more sensitive to oxygen loss, and clot formation becomes easier and deadlier. What makes this habit so dangerous is that it feels productive or responsible. Many seniors believe they are helping their health, when in reality they are increasing their stroke risk day by day. Doctors are begging seniors to stop, not because they want to scare you, but because they see the same pattern again and again. Sudden weakness on one side, slurred speech, vision loss, loss of independence. And families always say the same thing.
You're doing great.
He was fine yesterday.
Rest now.
In this video, I'm going to explain what this daily habit really is, why it becomes extremely dangerous after age 60, how it silently increases stroke risk, and what doctors in the US recommend instead. This is not about panic. This is about prevention, because once a stroke happens, life doesn't just go back to normal. So before you continue your usual routine tomorrow morning, stay with me. What you learn next could protect your brain, your independence, and your life. In part 2, we'll reveal the exact daily habit doctors are warning seniors about, and why it becomes explosive after 60. The daily habit doctors are warning about. So what is this one daily habit doctors are begging seniors over 60 to stop? It's not smoking. It's not alcohol. It's not even sugar. The habit is sitting for long, uninterrupted periods every single day. Yes, prolonged sitting, especially after age 60, is now being called a silent stroke trigger by many U.S. neurologists. Here's why this shocks most people. Many seniors sit for reasons that feel responsible and safe, watching TV, reading, driving, eating long meals, or resting because they feel tired. Some even believe sitting protects their heart. Doctors say the opposite happens. When you sit for long periods without movement, blood flow slows down, especially in the lower body. Over time, this causes blood to become thicker and more likely to clot. Once a clot forms, it can travel straight to the brain, causing a stroke without warning. After 60, this process speeds up dramatically. Blood vessels lose flexibility. Circulation weakens. The heart has to work harder to push blood upward. Doctors in the U.S. report that many stroke patients share the same pattern. 6 to 10 hours of sitting daily, very little movement between sitting sessions, long TV watching or phone use, sitting immediately after meals. What makes this habit extremely dangerous is how normal it feels. There's no pain, no immediate symptom, no signal from the body saying stop, but inside the arteries damage is happening silently. Studies show that sitting for more than 60-90 minutes without movement significantly increases blood clot risk, inflammation in arteries, blood pressure spikes, reduced oxygen flow to the brain. Doctors say this is why strokes often happen. Early morning, after long periods of rest, or suddenly after standing up, many seniors assume exercise later in the day cancels out long sitting. Doctors warn it doesn't. You cannot undo 8 hours of sitting with 20 minutes of walking. This is why doctors are begging seniors to break this habit, not tomorrow, not next month, but today. Because once a clot reaches the brain, treatment time is limited. Every minute means more brain cells lost. And recovery after 60 is much harder than people realize. The most dangerous part? Many seniors who suffer strokes were not overweight, not smokers, and not diagnosed as high risk. Their biggest risk factor was simply sitting too long. too often for too many years. In part 3, I'll show you what doctors recommend instead, how to protect your brain without intense exercise, simple movement rules that reduce stroke risk immediately, and one powerful habit that can lower risk within weeks. Stay with me. Part 3 can save your independence. Doctor-approved solution and final warning. Now let's talk about what doctors actually recommend, because the goal is not fear. The goal is protection. U.S. doctors are not asking seniors to run marathons or lift heavy weights. In fact, intense exercise can be risky for some people over 60. Instead, doctors focus on breaking prolonged sitting, because that alone can dramatically reduce stroke risk. The number one rule doctors agree on is simple. Never sit longer than 30-45 minutes without movement. Even light movement is enough to restart circulation and thin the blood naturally. Doctors recommend standing up, walking for 2-5 minutes, stretching arms and legs, gentle pacing inside the house. This small action helps restore blood flow, reduce clot formation, lower blood pressure spikes, improve oxygen delivery to the brain. Neurologists say this single change can reduce stroke risk within weeks, not years. Another powerful doctor-recommended habit is movement after meals. Sitting immediately after eating causes blood sugar spikes and thickens blood, especially dangerous after. Doctors suggest standing or walking for 5 to 10 minutes after meals, avoiding couches or beds right after eating. This simple habit improves circulation and protects arteries. Doctors also strongly recommend hydration. As we age, the sensation of thirst weakens. Dehydration thickens blood, increasing clot risk. Many stroke patients arrive at hospitals mildly dehydrated. Doctor advice: drink water regularly, not all at once. Keep urine light-colored. Increase water intake in hot weather or when sitting long hours. Another key recommendation is morning movement. Many strokes occur in the early morning because blood pressure and clot risk are highest after long rest. Doctors suggest gentle stretching after waking, walking for a few minutes before breakfast, avoiding sudden standing from bed. These small habits protect fragile blood vessels in the brain. Doctors also warn seniors to listen to subtle signs, not ignore them. Sudden dizziness, brief vision changes, short moments of confusion, numbness that goes away quickly. These can be mini warnings. Ignoring them is dangerous. Here's the final truth doctors want every senior to hear. Strokes don't come from one bad day. They come from years of silent habits. If you're over 60, protecting your brain means sit less, move more, gently, break long sitting sessions, stay hydrated, respect early warning signs. This is not about fear. This is about staying independent. Because a healthy brain means clear speech, strong memory,
Freedom to walk.
freedom to live life on your terms. If this video helped you, share it with someone over 60. One small change today can prevent a life-changing emergency tomorrow. Your brain is worth protecting.